Pregnancy is an exciting time, but it can also be frustrating for first-time moms. There are so many pregnancy myths. What you read on the internet or in books can be confusing. During your first pregnancy, you learn what is safe and what is not. However, it is recommended to be very careful at every step to be taken in this process. Can you masturbate while pregnant? Some topics such as masturbation during pregnancy can be considered taboo. Some women may be embarrassed to ask if masturbation during pregnancy is safe or poses a risk to their developing babies. The answer is simple. Masturbation is a natural, normal act. It's generally okay to masturbate during pregnancy unless your pregnancy is high risk. Here is another thing you should know. Masturbation is a normal, natural act. A pregnant woman is still a woman with sexual needs. Many women find that their libido actually increases significantly during pregnancy. As progesterone and estrogen increase, your sexual appetite may also increase. The reverse may also be true. Some women may feel that they have no interest in sex or masturbation in the process. This is understandable amid nausea, vomiting, fatigue, and physical changes in your body. If you are experiencing normal or increased desires, sex and masturbation should not be an issue during a low-risk pregnancy. Your doctor will likely advise you on whether vaginal penetration and orgasm is a problem. Some women notice a slight cramping sensation after reaching orgasm during sex or masturbation. This sensation is related to the contraction of muscles and can trigger Braxton Hicks contractions, a type of irregular uterine contraction that eventually thins and disappears. If you have a high risk for preterm birth, orgasm may increase your risk of giving birth prematurely. The semen discharged into the vagina can also cause the cervix to soften and trigger labor. For non-high-risk women, sex and orgasm may be considered normal. What are the benefits of masturbation during pregnancy? Many women find masturbation to be a great stress reliever during pregnancy. Masturbation can be a satisfying alternative, considering your growing belly makes sexual intercourse more difficult. As your pregnancy progresses, it can be difficult to find sexual positions that are comfortable and enjoyable for you and your partner. Some men may worry about sex for fear of harming their partner or the baby. Pregnancy affects the body in many ways, and these changes can be surprising. Feeling comfortable with your body during your pregnancy can be a very positive thing, and masturbation can be a helpful way to do that. Masturbation during pregnancy can be physical pleasure, relaxation and relief for what we have mentioned below. Morning sickness, backache, sciatica, swollen feet. Masturbating during your pregnancy doesn't have to be any different from other times. If you often use toys or devices, discontinue use if they cause discomfort or cramping. It is also important for health to ensure that these items are properly cleaned before use. When should masturbation be avoided during pregnancy? Your doctor may advise you to avoid sexual intercourse according to the course of your pregnancy. They may recommend this at certain times or even for your entire pregnancy. The following situations may require you to avoid sex. You are experiencing symptoms of preterm labor or have a history of preterm birth in previous pregnancies. You have been diagnosed with placenta previa or an incompetent cervix. You are experiencing vaginal bleeding. Specifications vary, so if your doctor doesn't recommend sex, ask what exactly that means. If you have a risk-free and healthy pregnancy, masturbation, sex, and orgasm are safe and normal ways to relieve tension. Masturbation while pregnant may not be a problem unless your doctor advises against sexual activity. It can mean intercourse, orgasm, or both, or it can simply mean penetration. If your doctor advises you to abstain from sex, ask if this includes masturbation.